Dr. Kyle with All About Chiropractic. Today we're going to talk about carpal tunnel. And for those of you that know what that is, you're probably experiencing pain down in the wrist. And when we talk about carpal tunnel, there's actually a tunnel that runs through our wrist where all the muscles and ligaments that control your hand, the nerves, the blood vessels that go through to power your hand and your mobility and your fingers in your hand. And so that tunnel is about the size of my pinky. It's not very big, so there's a lot of stuff that need to go through there in order to power your hand and to give you the mobility that you want within your hand. And so when we talk about the carpal tunnel, there's a couple things we need to evaluate. Is it truly a problem in the wrist, or is it a problem in the neck? And the reason why I talk about that is because 50% of carpal tunnel surgeries fail. They don't work. Somebody has the surgery and they're still getting numbness and tingling in their hands. And I actually just had a friend of mine that's a patient send me, he went and had the surgery done, and they took the 8 little bones in his wrist, and now he essentially has 3, and he has 7 screws in there. And his mobility in his wrist is not what it was before the surgery. And so I'm interested to see if his numbness and tingling comes back or not, because typically the problem is not in the wrist, it's in the neck. And so when we address the power to our hand comes from our neck. The nerves that leave the neck here come down in order to give us the mobility and the function in our hand. And so if we have a pinched nerve in our neck, putting pressure on that, it's going to cause numbness and tingling down in the hand. And so first step is always to identify if this is what's causing it. And if this is what's causing it, we need to correct it. Now there's other things we can do as well to help the wrist here. All the muscles in the forearm control the fingers. And so sometimes we can even have super tight muscles in the forearm that are causing issues in the ligaments that come down into the hand, giving the mobility in the hand the problem, or putting pressure on the nerve that actually goes down there, causing the numbness and tingling and the pain that's actually experiencing into that wrist area. And so I've had patients literally scheduled for a surgery that canceled the surgery because we addressed their neck issue and their forearm wrist muscle issue, and the carpal tunnel issues went away. But the only way to know that is to do the proper testing. And what I mean by that is we want to actually see the structure of the spine here. We want to look to see, is there a subluxation in the spine, putting pressure on that nerve, causing the numbness and tingling that ultimately radiates down into the wrist and the hands here. And so without taking the proper testing, which is taking the x-ray to see the issue, if that's going on, I know that it's going to contribute here, and ultimately we're going to be able to get it to go away. But like I said, we got to take the x-rays to see what's going on. And so when you schedule your appointment to come in, expect me to want to take a set of pictures. I want to see the x-rays. I want to see what's going on there, because I want to know truly what's causing the problem, so that way we can dig in and we can correct the problem. And so when you come in, we'll take the pictures, we'll do all the testing that we need to do in order to identify that issue. And then ultimately, we're going to figure out the course of correction. How do we get rid of it? Okay, we're going to start working on the neck treatment-wise here to get the bones moving, pressure off the nerves. But then if we need to work on the forearm or those muscles in the wrist, okay, in the forearm here, to get that functioning properly, we're going to do that. As a chiropractor, I adjust the neck. I can adjust the shoulder. I can adjust the elbow. I can adjust the wrist. If it's a movable joint and it's having an issue, we can get movement back into there, ultimately taking pressure off your nerves, so that way the symptom goes away. And in this case is that numbness and tingling down into those hands. And so if you're experiencing that, the link below is going to allow you access to my calendar. It's going to allow you to get on there. It's going to give you a time where we can set up 45 minutes to go over your problems, what you have going on, and ultimately what it's affecting. Because I want to set goals so that way I have markers to hit in order to know, is the care that I'm recommending working for you? So just click on the link below, schedule a time to come in and meet with me, or give the office a call. One of my staff members would love to find a time to help you get back to the things that you want to do. So once again, click on the link, give us a call. We'd love to help you. Dr. Kyle.